Welcome back. From trends to the concerns, the top leaders from Southwest Idaho's largest healthcare organizations held a joint news conference today to share what they've been seeing when it comes to the pandemic, and they're asking for your help today. Our Shira Matsuzawa listened in on that news conference. She's here to break down what was discussed and the message, Shira, that they have for everyone.
That's right. You know, Mark, those healthcare organizations include St. Luke's, St. Alphonsus, and Primary Health, just to name a few, but they say they've been working closely together since this pandemic started, and now they're sharing what they believe needs to be done in order to curb this virus.
Today is the day to show you the COVID train has left the station. Idaho is well on its way to becoming another New York, California, Texas, or Arizona. But we have the opportunity to turn that train around.
8 healthcare leaders from St. Luke's, St. Alphonsus, Primary Health, West Valley Medical Center, Salter Health, and Sawtooth Epidemiology held a joint news conference Tuesday to discuss what they've been seeing during the pandemic and what they want to see moving forward.
On June 26th, we had 20 COVID-19 related admissions. On July 2nd, we had 40. On July 7th, we have 51. And today we have 77. We see no change in this trend.
St. Luke's Health System President and CEO Chris Roth says, while those numbers are specific to St. Luke's, other health organizations are seeing similar numbers, and their projections suggest COVID-19 related admissions will double every 2 weeks.
We predict that within 1 month's time, we will see a doubling of our total inpatient volume. Within, just let's say by Labor Day, we would expect as much as 50% of our total inpatient volume across all of St. Alphonsus Health System will be consumed by patients that have coronavirus.
Which is why they're collectively asking the public for 2 things.
First, we're asking for the community to be more vigilant.
That means wearing face coverings, maintaining social distancing, and washing hands frequently.
Our second ask is that we're calling on all members of the community to contact your local and state officials, boards, commissions, all those who have the ability to make policy. Please contact them and urge them to require the use of face coverings as a community expectation.
At Primary Health, staff are seeing more than 400 patients a day, and even then, they're having to turn people away.
There is such a demand for testing that we're scheduled out 2 days in advance.
At St. Alphonsus, Dr. Stephen Nemerson says 1 month ago, mobile testing sites and respiratory clinics were testing 20 to 40 patients a day. As of last week, that number jumped to 800 a day. Another main concern health organizations are seeing, hospital staff getting sick because of community spread.
We have gone from a month ago having 25 of our colleagues quarantined to today we sit at 123. And we don't have other colleagues to go find to bring in that know our system.
The numbers are frightening. The trends are more than concerning, but we know that we have the opportunity to turn this around.
Well, I want to end with a quote from Mr. Roger, which is, quote, "Real strength comes from helping others," unquote. We need all of us to help slow this virus.
Again, they're collectively wanting to see a mask mandate because they say that will help stop the spread of COVID-19, especially when it comes to hospital staff, which they say are the most critical resource in this battle. Now, St. Luke's also talked about Samantha Hickey, the nurse practitioner who died after her battle with COVID-19. She was just 45 years old. Roth says her death is a reminder of the gut-wrenching effect of this pandemic. Mark?
What's your takeaway after listening to this, Shira? Mine was one of utter seriousness among all of these healthcare professionals, but also one of optimism.
Oh, I agree, absolutely. Optimism, but also they wanted to convey the seriousness of this, but also how important it is to wear a mask. And I think that was probably their #1 message throughout the whole conference call.